joined us tonight on this very, very cold day. We really appreciate you. And so before I start, I just want to lay out some ground rules. Tonight, I will be facilitating today's webinar. The topics were just shared. We're going to have a brief discussion from Montefiore Emergency Department staff on some current conditions, and this was a request that came urgently to the committee and we wanted to accommodate. And then we will also have a community health needs assessment presentation from Montefiore as well. So pretty robust topics here. And just, I think most folks are familiar with Zoom, but if you're joining by phone or need to get refamiliar, so if you're joining from a landline or cell, to hear all available commands, you enter ** on your phone, *6 mutes and unmutes you, and *9 virtually raises your hand. Tonight, we are going to follow the following protocol. Everyone besides the speaker or presenter will stay muted throughout the webinar. Again, *6 mutes and unmutes you. After each presentation is over, I will inquire if anyone has questions. You may signify that you have a question by pressing the raise hand button on the Zoom screen or by pressing *9 and virtually raising your hand. Only those recognized by the facilitator will be allowed to speak. We will stay on topic with agenda items, and since this is a webinar, the committee cannot conduct board business. All voting matters must be brought before an in-person committee meeting. And so with that, again, really grateful for everyone joining tonight. I really appreciate Bronx Community Board 7 staff and District Manager Carla Carrera for accommodating this webinar. We're so happy that we will be able to hear from different parties today. And so I want to get us right started and invite whether it's Judy Sheridan, or other reps from the Montefiore Emergency Department to provide their discussion items for this webinar.
Thank you.
Yeah.
Thank you, Michelle. It says we can't put our video on. That's fine with me because I'm cooking, but I thought you would want us on video, but whatever.
Oh, that's strange. Hold on. Let's see if Carla can.
Yes, I'll make you the co-host.
Me?
Yes, no, you have to be a co-host in order to be able to share your video.
Oh, I don't care. You
Right.
can keep my picture. It looks better than me, but.
Yeah. All right, you should be able to share your video now.
Okay, I got it. All right, thank you. I'm on my phone, so I'm in the kitchen. I'll just turn off the soup. I've been trying to make soup all day, but I've been on phone calls all day. So hi, my name is Judy Sheridan Gonzalez. I work in the Monte ER for about 40 years. I'm formerly president of NISNA, the whole state union, and I'm a delegate at the Montefiore in the executive committee of Montefiore. We're calling for this emergency meeting because the conditions that have already been really challenging in our ED and in our hospital have been exacerbated lately. I did send you a written sort of summary. I'm sorry that it was so detailed, but we now have a situation where for the first time ever, everyone from people who mop the floor, ancillary staff, to techs, to CNAs, to nurses, to nurse practitioners, to PAs, to residents, to attending physicians are all united in our terror at what's going on in our emergency room, what's happening to our patients. This is not a new issue, but it has become much worse this year. It started with the reduction in beds, in inpatient beds, and to understand that we on a daily basis have many patients in the EDs waiting for beds. The way Montefiore has handled that is by creating something called hallway beds, where many of our patients are sent upstairs to the units where they're in hallways without toilets, without bathrooms, without water, without anything, but yet they're admitted. We have asked repeatedly for Montefiore to open more units. They have closed about 200 beds in the meantime since, in the past, 20 years. The emergency room itself, the physical plant, has not been enlarged for about 20 years. Our patient population has quadrupled. So you can imagine how crowded it is and how dangerous it is. But lately, since the move to restructure the hospital and close about 30 beds upstairs, things have gotten worse. We are now in the middle of our respiratory emergency situation where people have flu, COVID, RSV, other infections, pneumonias. People get really ill this time of year. The emergency room gets even more overcrowded. And instead of enlarging the emergency department and instead of creating more inpatient beds, what the hospital decided to do was just try to compress things even further to fit more bodies inside. And they created this whole vertical ED that I believe somebody else will speak to. We have providers on the phone, we have nurses on the phone who are going to give their presentation. The conditions are so dangerous that we have now a situation where patients are actually in the hallway outside the emergency room where people come by with garbage and all kinds of things. Some of them are critically ill. They're on monitors because there's basically no room. They're using the waiting area to put patients on stretchers, and people are forced to sit in chairs when they absolutely really need beds. And there's other practices that are occurring that go against all of the training that we've had to provide quality care. We absolutely feel that the hospital needs to enlarge the ED, find space. We've been talking about this forever. We have located space. We know that we have areas in which these patients could be situated and be treated like human beings. And we are also very concerned about the disparities in the care that our patients get compared to the patients in Montefiore's hospital in White Plains. In White Plains, they don't have hallway patients. The EDs are not overcrowded. They renovated the emergency room in White Plains Hospital, which was already beautiful, for a cost of $50 million. They have not done anything for RD, and we believe, and patients believe, that it's because of the makeup of our patients. Our patients are basically brown and black people. Many are immigrants. They're not English proficient. They're poor. They have Medicaid, they have Medicare. We have nursing home patients. All the nursing homes bring their patients here. And while they may have once had a better standard of living, they are vulnerable. They don't always have families advocating them. We are the only advocates for these patients. We also have a mental health crisis where instead of creating a unit that's big enough to accommodate some of these people while they're being evaluated, they're shoved in an area that is just totally inappropriate for them. So there's non-therapeutic care going on. And we are losing people. And I think we'll have people talking about that. I think can Susan get on? Kevin, are you able to reach out to her? Susan?
Judy, I'm
have-
here.
Texted her.
Okay, great. So maybe you can talk about, as a provider, do you have questions for me before Susan speaks, or do you want to wait till we're all done?
Judy, no, I thank you for the thorough overview. And I would ask if there are a couple of speakers, just want to be mindful of time.
Right.
If folks can keep remarks between 2 and 3 minutes, and then if folks can also just hold questions or put them in the chat for now so that we can hear everything from the emergency department staff first, and then we'll do some question and answer. So if you think you're going to lose your question, please put it in the chat. And then for the speakers, really appreciate your time, to everything that you do, but we want to make sure that we have a chance to hear everyone, and we also have a presentation, so just want to be a little mindful of timing.
Oh, thank you so much. Here goes Susan.
Hi, good evening, everybody. I am unable to start the video, but I was asked just to talk from the provider's point of what's going on. And I think the most important thing for the community to know is, due to the conditions right now in the ED and forced changes to the doctor's schedules, we are losing some of our most highly trained emergency room physicians. They have already handed in their resignation. There are 6 that have already handed them in. There's probably another 5 already that are actively just waiting to sign letters of intent with other hospitals. When you think about what that means to get new doctors into the community in our ER that's already understaffed, overcrowded, you can already figure for yourself what this would mean, the crisis that would entail in order to get people seen in a timely fashion and taken care of. We're also losing some of our most highly academic physicians, brilliant doctors that do the teachings for the residents and the interns, as well as the mid-level. So that's another issue that I think the community needs to be aware of. Again, I really want to talk from the provider point of view. And again, I think it's, I'm trying to be mindful of your time. We've already lost over 20% of our attendant staff, and there's more to follow. So unless there's any questions, I think that hits the highlights. Anything else, Judy, that you want me to go over with that?
Well, just about, I think Majasa is going to talk a little about being told to change the way we practice, so we can have her do that. But, yeah, I think what Susan's saying is this has not happened. Also, this is unprecedented because of the conditions and because of the way that we're being told to practice. People are just terrified that they're going to be losing their licenses for malpractice, and also, more importantly, just giving wrong care, giving care that violates the things that we learn to our patients in order to get them in and out quicker and just save space in the ED. So I would ask Mojasa, another provider, or to speak next.
Yes. Yes. Hi, this is Pia Mujad. Can everyone hear me?
We can hear you. Thank you.
You're welcome. Thank you so much for having me on your meeting. So I am one of the PAs. I'm there for 16 and a half years. And recently we have change in management, and we were told that if the patients are assigned to certain areas, we are not supposed to give them IV. It's only oral medication, IM medication. Some of these rules are going against the standard of care for our patients. A patient that comes in with vomiting, with diarrhea, who needs IV fluid, IV hydration, needs IV medication. I cannot give him pills. I cannot give him multiple rounds of injections. It's just not fair to the patient because they want to put these patients in on the chair. That's the issue. Or a patient with migraine headache, they cannot have oral medication, or they already failed oral medication at home and they need IV medication. So we are asked to change the way we used to practice medicine, or we supposed to practice medicine. That's a standard of care. We are asked to change that.
Okay, and now, John, can you just talk about the situation with the vertical ED and the housing of patients in the hallways and the issues of patients throwing themselves off the chairs and so forth? John is one of the
Yes.
registered nurses. He's relatively new, and he was excited to be at Monty, and now he's disgusted. Go on, John.
Yes. Hello, my name is John. I've been a Bronx resident for more than 2 decades in the Van Ness Morris Park area. I just want to talk about a little bit about the environment. Part of the part of Monty's solution is put patients in the hallway. The hallway is not conducive of care. There's cameras. It's next to a linen dressing room. People. Some of the patients are afraid to simply use the bathroom because of the camera. If there's an emergency, uh, we have to bring all the code cards, which is nearly impossible. And also, when we're transporting patients, we are in the situation with a tight space and have to remove certain patients back and forth and play Tetrises. Um, uh, some of the nurses are are I could see the burnout in their faces, and they've been speaking to me that things need to be changed in the hallway. When I take care of critical care patients, it's sometimes I have to run around. I can't even sit. I can't even go to the use the bathroom, and it's very difficult on the patients.
Thank you, John. And then Beltran, can you talk about what's going on with the issue with the mental health crisis?
Good evening, everybody. Thank you, Community Board 7, for hearing us. Nelson Bertrand here, Bronx boy, born and raised. I've been at Monty for about a year and a half, and most of my shifts I work in behavioral health. We have a serious situation where you have nursing home patients mixed with behavioral health patients. Um, I you have excuse me, you have behavioral health patients, you have alcohol intox patients, drug abuse patients, all mixed in together. Basically your grandma, your ma, your aunt, your uncle mixed in with a guy who OD'd on fentanyl, or who, took a weekend bender and now he's drunk and irate. We had a situation where one of these behavioral health patients actually urinated on a nursing home patient, a patient who couldn't fend for herself, who couldn't move, who couldn't do anything, and there was nothing that we could do. The patient urinated on her. We have overcrowding in that area where you have people with RSV and flu and COVID mixed in with cancer patients, with immunocompromised patients. It's not conducive for proper patient care. I wouldn't want this for my family member. I wouldn't even want my family member to come to the ED. It's so overcrowded. The way we're structured with the staff and the mental health patients, it's a powder keg. I've been attacked. I've been hit. We have patients who try to run. We have patients who attack the staff members. It's a mix of behavioral health and also medical that it's not working. So something needs to change, and we've spoken to management about it, and we need more space. We need a separate unit for behavioral health as opposed to medical. Thank you.
Thank you, Nelson. And this is something we've brought to the attention of Montefiore, the need for more space, and we've located spaces that they could easily convert. They created an Ebola unit that could be converted into a mini kind of an ICU. They're not doing it. They have office space that they could use in all of their other areas, and they're not doing it. Space is essential. And all these stopgap measures that instead of creating space are now forcing us to mistreat our patients. Unless we violate their directives, and we are violating their directives. So most of us will not compromise the kind of care we want to deliver, but the pressure and the fear of termination for not following a directive is really overwhelming. Lou, do you want to talk about, having been here for so long and some of the phone calls that you get when you do follow-ups?
Sure, Judy. Thank you. I appreciate you all giving me a bit of time. My name is Lou Gelibert. I'm a physician assistant that has the pleasure of caring for this community for almost 40 years. I met my wife here, and we're happily married for 33 years. As a PA, I've seen a lot of changes, some good, some not so good, and we're all for change to benefit the care for our patients. But this recent change was very abrupt, without communication with the staff, without introduction of new leadership, and it's all to satisfy the metrics for the star rating that Medicare has out there for hospitals, at the expense of care for our patients. I also man the phone up in the follow-up office, where I follow up labs, things like that, contact patients, make sure they were treated appropriately. I received a couple of voicemail. One really stuck with me. A lot of calls are just funneled to our office from the hospital operator. And one of the calls was this past week, was a patient that just walked out of the hospital. She, what we call, eloped. She just got up and left without telling anyone. And in these instances, the staff will try and contact them, ask them where they are they okay, why'd they leave. So I'm assuming she received multiple calls, because she tried to respond, and then the call was funneled to my office. I listened to the voicemail, and she was saying that she was very frustrated and angry, and that she sat in a folding chair for many, many hours, felt neglected, so she decided to leave. And she left, and she says, she left with the IV still in her arm, stating that she has to take the IV out, and that she also gave kudos to the provider and the nurse, that they were doing the best they could under the conditions. But she said it was just, she felt disrespected, neglected, and that she would never come back to this ER again.
Is there anyone else who was supposed to speak, or do you want me to summarize? Okay,
If there's anyone else that was going to speak, I do want to allow them the opportunity to. So yeah.
Anyone else? I know we have a
No,
bunch of
Judy,
people on the
yeah.
call. Yeah, okay, just to summarize, the bottom line is we need more space. And if there are changes to be made, because perhaps there's issues that we're not aware of, we're at the ground, they say some people at the top are at 30,000 feet or whatever, and they need to share with us what's needed. Our basic concern is that we always put the patients first. Those of us who work in the ED, was very challenging. We see a population that very often is very ill, or they don't have access to primary care or specialty care, so they come to us. And we understand that there are so many challenges that these patients face, and we try to do whatever we can to help them and to get them on a path for recovery, and also to be able to take care of their emergency situations. And it is very challenging. We often deal with life and death situations, or with families who are facing the sudden loss, or really serious issue that happens to a loved one. It's a very stressful environment. And the violence against us has increased dramatically, not because, our society is more violent anyway, but mostly because people are so frustrated, because the care they're receiving is so outrageous. And Montefiore's excuse is, well, they don't have a good insurance base for this community, but people with insurance have the option to go elsewhere. They won't come to our emergency room anymore unless they have no other choice. So we have the most vulnerable people with the least amount of resources, and what they're getting is not what they deserve. And when we brought this to Montefiore's attention in the past, they've said, well, these people should be lucky that we're here. That was their attitude. And I think that that's a really unacceptable attitude. So we need more space. We're engaged in, I know you can't make any decisions, but we'd like the support of the community board to be able to protest these conditions and correct them so that we can keep talented providers and talented nurses and staff back in the Bronx, and also to give our patients the care that they deserve. Your level of care should not depend on your zip code or your income level or what you look like or what country you were born in. So basically that's it. We would just want pressure on Montefiore to expand the space so that our patients can be treated with the dignity that they really deserve.
Thank you, Judy, and thank you to all of the healthcare providers that are on this call, again, for the work that you do day in and day out, and also for taking the time on top of that to be here to share with the community some of what you're experiencing. I do see a couple of hands raised, so I will call on folks. Please keep your questions brief. Again, we want to respect folks' time, and then Carla, if you want to chime in to say anything, happy to hear from you. So I'll start with Jake.
Yes. Hello, can you hear me?
We can hear you, Jake.
Okay. I like to thank the staff at Montefiore Hospital. I know you all do your very best. I experienced everything that you all are saying there when right before my mom died. I took care of my mother for 14 years, and during the pandemic, it got really bad. But what I want to say is 4 years ago, you all went on a strike. You did something, and it raised knowledge to awareness to the community and everything, because I participated in it. So I think it was either 3 or 4 years ago that you all walked out. You did something to that nature.
So Jake, yeah, Judy or Judy,
Yeah,
I think,
sure, I can just
if you could
quickly.
speak to
Yeah,
that, yeah, just
very
to
quickly.
clarify.
It was 3 years ago. We had never been on strike before. This was based on staffing. What happened during COVID because of the shortage, and obviously we were the highest, we had the highest rate of COVID infection and deaths from COVID
Yeah.
in the entire nation, I think in the world, at Montefiore. It was incredible. And we lost some of our colleagues, and many of us got sick and have long COVID because, of course, we weren't protected. So that was a big issue. But we went on strike because what happened during COVID, because of the shortage, we were taking care of like 20 patients each, which was
Right.
absolutely. And so we went on strike for staffing. We wanted better staffing. We said we can't take care of people under these conditions. And of course, it was COVID, so we understood, but they didn't change it. So we went on strike to get more staff. As a result of the strike and the pressure and the wonderful support we have from the community, Montefiore hired approximately 500 nurses in 2023, the first year of the contract. And in fact, it didn't cost them anything. They made a profit of $143 million that year. So clearly giving better care and doing the things that are needed to provide better care is not going to create a financial deficit for the hospital. They've proved it themselves. But on that contract, part of our contract also demanded that they create more space and end hallway patients and treat our patients with dignity. We actually have that language in our contract, and they're not doing that. So I hope we don't have to go on strike again.
That's what I'm talking about.
Yeah,
Why
yeah.
don't you all go back out again and demand that? And isn't that against the HIPAA rules to have patients in the hallways? They've been doing this practice for the last, I'm gonna say, about 6 years now.
Yes. So what we're dealing with now is that the conditions are even worse. I think we've never had this level of unity among all the staff who are feeling just outraged and violated. Like Susan, who got on early, she's in the National Guard and she's served in Iraq and in war areas. And I myself have done disaster work, and the care we delivered in war-torn areas, even among captives, and certainly among people who've been victimized by earthquakes and hurricanes. We had several teams that went to Puerto Rico. We were able to give them better care in a basketball stadium. with no
Wow,
electricity than what they're
that's
getting now.
disgusting.
Yeah, so
So Montefiore is operating on like they're in a third world country.
that's what everyone says.
That's absurd.
You.
Hey, this is Susan. I was just listening to what you were saying, and it's absolutely correct. I was a lieutenant colonel, 21 years of service in the Army. I served in Iraq. I did medrecs in El Salvador right after their war-torn guerrilla days. And I can tell you that some days I walk in here and say, this looks like a third world country. We gave better, more dignified care for my detainees in Iraq. And that's 100% true.
Thank
Wow,
you,
that's so
Susan.
sad.
It is very sad. Thank you, Jake. I see another hand up. Toby, go ahead, unmute yourself.
Okay, I've unmuted myself. So I have a question. I know that we are specifically talking about the Montefiore that is located on Gun Hill. I am correct with that.
Yes, but the
Okay.
conditions are very similar in the Weiler division as well. That's located on Eastchester Road. We're
Okay.
just a little more crowded. We're just a little more crowded, and we also get sicker patients because we have with specialty services.
Okay, because that was my question. Because I know of 3 sites. There's a site on 233rd that's Montefiore. There's a site on Eastchester, and I'm worried. I want to know, are those sites experiencing the same thing?
I certainly know that in Eastchester that it's very, very similar because the reason we know is because we communicate directly with them, or the nurses are in the same union, so we have the same contract. I know that Wakefield, the site on 233rd, also has a lot of challenges. I don't know if it's to the extent that our challenges exist, but I believe that they are also facing some very difficult situations and conditions. But Montefiore's solution in terms of space says, oh, we have regional beds. We're going to transfer patients to Mount Vernon if they need beds, because after an 8-year battle against Montefiore to keep Mount Vernon open, we finally won. They're keeping it open. They're expanding services, but we know the patients in Mount Vernon are going to return there. Plus, our patients don't have cars. They don't have money to take cabs. They can't take a four bus ride over to Mount Vernon to be admitted. People want to take care of their loved ones in their neighborhood. So that's not a solution. That's what they're going to tell you. Oh, we have enough beds. It's regional. Well, it's not the same region when you have people who don't have automobiles and also, want care in their communities. People want to bring people their food. They want to advocate for their loved ones. So that's not a solution. But yes, these are the conditions in pretty much all of the hospitals. I know we have intimate knowledge of the Weiler division and the Moses division, and some hearsay kind of knowledge of the Wakefield division. So it's similar.
Thank you, Judy.
Okay, thank you.
And thank you, Toby. Are there any other questions or comments? Carla, is there anything you want to add before I close this section out?
No, I just wanted to thank everyone for coming and voice your concerns. It definitely sheds a light into what's going on at the emergency department, and also something that we are seeing. Our healthcare system is one that's being hit, but we're also there. We have also seen a lot of development happening, and it has really put a strain on everything from our parks. And now we're hearing from you from our healthcare. And we appreciate you coming here, and we will brainstorm internally ways that we can definitely help advocate and amplify the voices that you're bringing to this meeting, to this webinar today. And we will be in touch and we'll follow up in the upcoming.
Thank you. I know you can't make decisions today. Maybe we can get your guidance on when we can present these. We're thinking of coming to the general meeting and sharing so that the community can be aware and help to us apply pressure, as has been done in the past, to have better conditions. So if Carla, maybe we can talk another time and you can help guide us on the best way to do that.
Or at the next health committee meeting next month when they can make a decision.
Okay, just let us know the best way we don't want to,
Absolutely.
This is an emergency.
Yes, we will,
it's an emergency.
We will be in touch. Yes.
Thank you so much.
Thank you so much.
And thank you for everyone for listening. And thank you to all my providers and nurses who are testifying. This is stuff that the hospital's fully aware, but they refuse to meet with us to problem solve. We're still trying to get a meeting with all of us together so that we can work together. And they're refusing to honor that. That's our first step, but they know what's going on, but they won't meet with us as a group.
Thank you. Thank you, Judy, Julia, again to everyone from the Montefiore Emergency Department here tonight that joined us. We really appreciate everything that you do for our community. You are right in that your zip code should not determine the type of healthcare you receive. And so we're super grateful that despite the challenges that you face on a day-to-day basis, your goal is to still provide the best patient care possible. We will absolutely follow up internally and then reach out, Judy and Julia, with kind of any recommendations for next steps on our end. And again, this was a request that we wanted to honor because we realize how important your work is. So please know that, we are here for you in the way that you are here for us. So thank you.
Thank you.
Thank you very much. Thank you.
Thank you very much. Thank you.
Thanks all.
Thank
Okay.
you.
You're welcome.
Welcome.
Thank
So
you.
Thanks, folks. We are going to move on to the second part of our presentation tonight.
I'm
And
sorry,
that,
Michelle.
yep.
I've been trying to find my raise hand button, but I couldn't find it.
Oh, no.
I just wanted to suggest real quick before everybody leaves.
Sure.
I think if they come to our community board meeting, to our general meeting, it might be a little more impactful only because the elected officials, representatives that are there would take note, and then that would get more notice to the elected officials that this is an issue and it should be responded to.
Absolutely.
Thank you,
Okay,
Edgar.
thank you. That's
Thank
next
you.
Tuesday, right? Is that next Tuesday?
Yes, Tuesday the 28th.
The 28th.
And where will that be?
I can share the meeting details with you after.
Great. I don't want to take your time up. Yeah, please send it to me. I'll share it with our colleagues. Thank you so much.
Thank
Thank
you.
you.
Thank you all. And so now we're moving to the second part of our webinar. We have a presentation from Montefiore's Office of Community and Population Health on their community health needs assessment. And so I invite Rashida, I believe, and I apologize if I pronounced your name incorrectly. Raisha.
Yes.
Hi. I
Hi.
apologize about that. Thank you for joining us today. Thank you for presenting to the public today. I have your PowerPoint up. Let me know if you'd like me to go through the slides or if you prefer to navigate on your own. I can give you share permissions.
Sure. You can go ahead and you can share the screen.
Okay. Give me 1 second to get this up. And Raisha, do you want to introduce yourself while I get this started?
Absolutely. Thank you. Hi, everyone. Good evening. My name is Raisha Hernandez, and I am the Health Equity Program Manager at the Montefiore Office of Community and Population Health. I know it's a mouthful. So we do work with the community on multiple programs around health equity and health education, awareness, and promotion. So thank you for allowing me to be here today on Community Board 7. And Judy and everyone who spoke, thank you for sharing as well. I think it's very important to know what's going on with internally, right? These are our community members, and what can we do to help? And this, I think, is a perfect segue to also mention our community health needs assessment, because this also reflects some of the social needs and also the health needs that are needed in our community. As the community health needs assessment, the next cohort would be this year, kicking off in 2025. And we actually just got confirmation. So this will begin the end of May, and it's going to go through the end of June. The community health needs assessment, for those of you who have not heard about it before, this is your first time. So this is done every 3 years. And again, it's to collect information from community members. So anyone who's 18 and over, they're able to take the survey and write down. There's 26 questions. We were informed this year of specific social determinants of health questions and how to prevent the particular areas and domains, which we're going to go over. And yeah, so I'll go over that. And we'd love to hear your feedback as well on how can we all work together, and also to just share more information about the Community Health Needs Assessment, or you may see the acronym CHNA. So quick agenda is that we're going to go do a quick overview of how that looked. Our last round was in 2022. So I'm going to give you a quick highlight, and also just let you know what are we looking for this year, for 2025, between 2025 and also 2030. Next slide, please. Thank you. So this is just to know also, the Community Health Needs Assessment is in conjunction also from that. Based on the results that are received, we develop a community service plan, and this is all internally within Montefiore, so different departments. We have met already with the Moses site, Moses, Wakefield location, also with on East Chester, which is your Weiler, and also Mount Vernon. So these are all the different locations that we do work together to build that community service plan, to determine what area are we going to work on. And this from 2022, we're going to share how that look and how that's going to shift just a little bit for 2025. Next slide, please. Okay, so the Community Health Needs Assessment, these are the highlights from 2022. This was our last round. So we completed around just over 1,400 surveys that we collected, which was fantastic. And this was all by Bronx residents. And just to give you a little lens also, the survey was completed either by paper, or they were completed by a QR code that they can complete on their phone device or an iPad or any devices that they were available they had on hand. And I can tell you that previously, this is actually my first round for the 2025 within this role, but I have seen it in action in other roles within Montefiore, as I've been here just over a decade. So the community health needs, you may see us at pantries, different health fair events, Bronx Week. So if there's any opportunity that we're able to attend, and to get as many residents as much as we can, and love to hear their feedback, especially like any social needs or any health needs such as that's currently happening in the hospital, or again just in their in their neighborhoods. So in the 2022, as you can see here, this was the dissemination plan. We worked, as I mentioned, with our hospitals and community advisory boards, Bronx community boards, as tonight, different community coalitions, different internal programming as well within Montefiore, and also externally with community-based organizations. And we have a large also program also with our medical students. So we're hoping to do that again this year and plus more, right? We have built more partnerships and relationships throughout the years. So we're able to kind of expand that outreach. And as you can see here on the screen, if you're able to see the presentation, this is the highlights were focused on the CHNA. These were the priorities. And they were broken into 3 categories. As you can see, is community service plans, strategic with the creation of the community, and then how were they addressed. Next slide, please. Thank you. So, and then this is these specific 2 areas that are highlighted. This is what was focused on throughout all of the different locations of the hospitals. We were looking at how to prevent chronic diseases. And as I mentioned, you see in the slide before, we were looking at diabetes, we were looking at asthma, among others, and cancer was also listed there as well. Promote healthy women, infants, and children, working with our WIC offices and also on maternal health. So these were specific projects, and again, depending on the location and the teams, and they were able to gather that information, and this was back in 2022, and you can see it gradually of how that has improved And then also what other resources are needed to continue to do those service plans. So they may look a little different for 2025 as the service plans might change and they may shift just slightly. And of course, the other unhighlighted fields were also still very important. But the highlighted ones, these were specific service plans that were identified by different internal stakeholders within Montefiore to continue to work on. Next slide. Thank you. So how was the 2025 and 2030 prevention agenda developed? So this is just to give you a sense of, so this comes from the state. So the state health assessment, they are the ones who create the surveys with their stakeholders and their leadership. And then that's disseminated out to us. And then we're able to implement those surveys and collect the responses. So this is developed outside, so we do not have any say in the questions. This is already, it's been made. So once we actually have access to that, I'm happy to share if it's at a general meeting or Carla, if there's any opportunity, I'll be happy to share those questions in advance once we get them. We haven't received them yet. So once we do, I'm happy to share. And just to let you know, also, I think one of the questions that came up from one of our other meetings was what languages are available. The survey is, so we were informed the survey is available in 16 different languages. And again, we will have access to paper copy, and also they're able to do scan a QR, and they can also complete it on their phone, and they can choose their language of choice. Next slide, please. Okay, so this is also just to see how you can see a little bit of the key findings. To the left, these were key findings that came about the last session of the 2022, and how's that transitioning over to the social determinants of health in certain critical areas in all of New York, and how is it defying those preventative agendas, and specifically priority to addressing direct and indirect factors, including health and the reflect of the needs of the community in the approach of healthy people overall between now and 2030. Next slide. Excuse me. So here, this is I think my favorite slide that kind of wraps everything up and also gives you a clear distinction between the 2019 and 2024. So you can see how the 4 categories are very different between the 2025 preventive agenda, which we're focusing now on economic stability. And these are broken up into 4 domains. Economic stability, we're looking at social and community context, neighborhood and built environment, healthcare access and quality, and education access and quality. And again, I know this is how we open up the meeting, so that access to care and that quality is an important piece. So this year, the prevention agenda is focusing more on that and the different factors that may arise from that. So hopefully, fingers crossed, those service plans can also be, I would say, more evidence and to show and more results that maybe perhaps we need more beds and we need more space at the hospital indefinitely. We need more. This came about from another meeting, also transportation, right? How are patients getting to the hospital or to their outpatient care if needed, or vice versa, right? So again, this is just more on the prevention agenda that they're focusing on in the next upcoming years. And the next slide, please. So in the next slide, I know it's a little bit small. So it's a framework that shows you each domain and what are some priorities that may fall into each domain. As I mentioned, one of them you can see is safety. You're looking at also, again, transportation. You're looking at injuries and violence. So this is different domains and the different priorities that, again, this all can come out from completing the survey. So the more responders that we have, the better. So then we're able to show this is what our community members completed, and this is the outcome. This is the work that we need to work on. This is what's needed most. Especially we're going to be looking at it also from different zip codes, so we can also see this area maybe needs more transportation support. This area also maybe violence is high. What can we do here? And again, this is different outcomes that can come out from completing the survey. And next slide. Okay, thank you. And this is just we like to share our timeline with all folks, just to let you know where we are and where we stand. So right now we are in Q1. So this is the beginning of the year. So we are right on track. I can tell you, and we spent the last few months right before the year started, again, attending meetings, spreading the word of community health needs assessment, what it is, how you can support. And we would love to share more education on the community health needs if we're able to. If you want us to come in internally to a meeting or even a community board meeting, we're happy to attend. And this is again just to show you, we use this internally, but we wanted to share also with the team just to let you know how that timeline looks, because it is a process. It's a process. So we would definitely be grateful for your support and appreciate it. And then the last slide is just next steps and how you can help. So as I mentioned before, if you know of any events at a large scale or even a small scale, so if you're at a community center or you work in a school, and we're able to come in and again educate the audience about the community health needs and how is it beneficial for Bronx residents to complete it, to have an opportunity for them to voice their needs, voice their opinions. We're able to do that. And as I mentioned, so anyone who's 18 plus can take the survey. Once we have more information about the survey, I am happy to share. Yeah, and once we do get our goal is to receive about 2,000 responders. Keep fingers crossed. I'm sure we can go over that. Once we also receive those results, we're happy also to look back. I would say towards once we're all done and data has been entered and this community service plans also have been selected, I'll be happy to share that also with the group as well. So you can see the progression of the work that has been done in the community. And that is my last slide. So if you have any questions about the community health needs assessment, I'm happy to answer right now, or if not, I can always share. Carla has my information, my email. Email is best. I have my phone number as well for the office. So you're happy to contact me, and yeah, I can share more information.
Thank you so much,
Of
Raisha.
course.
I think it would be helpful to just clarify. So once the surveys are collected and the responses are collected and the areas of focus are identified, Montefiore then builds a community service plan around it and then focuses in on the priorities, right? So we saw a couple of priorities listed, but 2 were highlighted. And I'm imagining that there were like more targeted programs, outreach, related to, I think it was maternal and infant care. So can you preview anything that might be an idea or an initiative that could come out of this community health needs assessment, since it is now focusing more on social determinants of health that are not like traditional healthcare metrics?
Sure, I can definitely one that has been ongoing. It could be also screenings. And this is screenings in general, screenings for different cancers. And I'm particularly focusing on cancers because this is also in collaboration with the BOLD team at Einstein. So this is also like there's foreseeing setting up their screening process and who gets screened. And that's the process that they're trying to improve on, and they're going to continue to improve that in the near future, is how to get patients to come in to get screened, and what is the process, and what are some of the barriers, and if there are any barriers, how can we eliminate that? So they do have, I know the bold team, they do have buddy system, they do have outreach representatives that are specifically also trained to do a lot of the outreach to get patients in. But we also keep in mind in our community service plans, if we're not able to kind of meet our goal that we're trying to meet, we also document what are some of the barriers, like if it's staffing, if we don't have enough resources, or just patients maybe don't qualify for the screening based on like their health questionnaire that they may have. We list that, and that's everything is listed on the community service plans.
Does any board member of the committee have any questions before I open it up to the public? Okay, I will open it up to the public. Does any member of the public have any questions for Raisha?
I think it was a lot of information. I would
Yes.
say I think that we're still processing it. And I think we will take your invitation and accept it to come back and take a deep dive into the community health needs
I just have,
assessment. I think you mentioned something about going through the forum or just
Yes.
taking a deeper dive into the whole introduction that you conducted today.
Sure,
I
sure.
just have
I
a,
can definitely
I
understand.
just have a quick question. I'm sorry. I'm sorry. I was once again I was looking for my little raise hand button, but I think because you gave us the authority, we lost the raise hand button. But my only question is just for clarity. Are you is the presentation correct in the budget year, right? Because I know that's part of health and hospitals, right? With the Montefiore and the city and the state, their budgets go from, like you mentioned before, you were talking about from June to May, right? That's the calendar of the budget year. But you're doing 2025 when in budget in the city and the state budget, this is actually the end of 2025 coming up because 2026 would start in June, right? Or would it be June
Yeah.
1st?
July.
July 1st. So I can step in here. So Edgar, you're right. In terms of budget and fiscal, they have different years, and those are usually ahead. So because this is a healthcare mandate, it's more on cycles. And so the community health needs assessment and community service plans are usually done in 3-year cycles. So they are in fact talking about like 25, like this year, next year, 26. So they're not, this is not related to funding that they're getting directly through the budget, state or city. It's kind of a regulation. It's mandated by the New York State Department of Health. And Raisha, please jump in and clarify that, please.
Oh, that was why I thought it was because of the funding. Because I would say if they're getting money, it's already going to start the 26th. But if it's they're independent things, then I'm sorry.
No, thank you. And thank you, Michelle, for explaining that perfectly. So, and then just to clarify, so the survey does, it starts on May 30th, and we have until the end of June. And again, it's a very short time frame to collect as many surveys that we can. And that's this year only. That's 2025. So May 30, 2025 until the end of June 2025 to collect the community health needs. So it's a very short window. A lot of outreach is going to be done, and hopefully Bronx residents are able to complete those surveys.
Thank you, Raisha.
So I have a question. I couldn't raise my hand.
Yeah, go ahead. Go ahead, Jake. And just before, so that we can all find the raise hand button in the future.
Yes.
Zoom moved it. So it used to be on the screen, but now you have to click on react with the little heart, and then it's the raise hand button. But you can go ahead, Jake.
All right.
Go
Thank
ahead.
you. So my question is, how are you all going to be fulfilling this survey? Are you going to be knocking door to door? Are you going to approach people in Montefiore Hospital? How are you going to conduct these surveys?
Sure, that's a great question. I can tell you definitely. So if there's any events happening at the hospital, you will probably see me there or one of my team members there, and we will be disseminating the surveys so folks can complete them. If there's any large scale events that are happening any throughout the Bronx and we're invited or able to attend, you will see us there as well. As I mentioned, if you know of any events that may be helpful for us to attend, and you'll be like, oh, Raisha, this is great. You should come out to this event. We do work a lot with different senior centers, different RAIN locations. They have already expressed an interest to come on out to do an education piece and also to give the surveys out to some of the residents. So I would say any opportunity that we can plug in, we can become flexible and amenable to do that.
Okay, I'll keep that in mind.
Definitely, definitely.
You
As I
leave your
mentioned,
information, right?
I'm sorry?
You're going to leave your information, right?
Yes, yes. And Carla,
Okay.
you can happy to share my information.
Okay.
Okay.
Cool.
So Jake,
Thank
you can reach out to me via text, email, phone,
Okay.
and I'll be happy to forward that information.
Okay, cool. Thank you.
I see we have Marcus with their hand up. Marcus?
Yes, my apologies. I couldn't find the unmute button. Regarding the surveys, I don't know if I'm jumping ahead too much. Well, I guess on the surveys, are there any features that limit the subjects and concerns of the community based upon specific zip codes or target areas? And if not, or whatever that answer may be, with the results of the surveys, is it just going to be for a general sense of the community, or are the results going to also target communities that like have a higher adversity? For example, with maternal health, if that were to be one of the results of the survey, would that mean that instead of like giving access to the entire Bronx, we give it to the entire Bronx, we also target like the zip codes with the highest numbers of infant losses and maternal deaths, or how is that going to work?
Sure, it's a great question. So thank you, Marcus. So to kind of yes and no to answer your question. So yes, every survey person who responder, if it's ideally that they enter a zip code in order for it to be fully completed. So with that zip code, we are able to again have that demographic and again see what resources may be needed in a specific area versus another area. In terms of the exact questions, how do they look like? I don't know yet. But once I get my hand on them, that's something that we can definitely share with the group. But I can definitely tell you that zip code is one of the priorities that we try to focus on to make sure residents and or any responder to complete it for that reason, as you expressed.
And Risha, that's a great question too. So you are all in the Greater New York Collaborative, right?
Yes.
So can you explain what that means in terms of like if someone's filling out Monty's survey, but let's say they're coming from another zip code, does that invalidate their survey response or does it then get carried over to the hospital in their area?
That's a wonderful question. So their survey is not invalid. It's 100% valid and it's still 100% useful and it's beneficial. And the reason being because we have many patients that they're coming from from the different boroughs, right? So even if they're in Queens and they're completing their survey by us, that information is going to go to the Queens nearby hospitals that is within their zip code. So that information is still important to capture. I can tell you a little bit that even we had some folks that perhaps completed in one of our areas, but they were from Westchester. So you can see again the zip code that they were in Westchester, but that is also giving information for that area and see what information and what support is needed. So it's by zip codes, yeah. So and again, as you mentioned, Michelle, definitely we won't say no to anyone. So it is completely anonymous, so they don't have to put any demographic, yes, but there's no name on it. So there's no name, and then the zip code again is very important.
Thank you. Super helpful.
Yes, yes. And
Any
again, sorry, once I have more information, I'm happy to share as they come along.
No, this is a very helpful heads up. Any other questions, board members, members of the public? Okay. Thank you. Thank you, Raisha, for
Thank you,
coming.
everyone.
Please stay in touch with myself and Carla as the survey launches. We'd be happy to host you at board meetings, committee meetings. We have a health fair typically in June as well. So there are a couple of outlets there, and we will do our very best to spread the word. We realize that this short survey window sets the priorities for the next 3 years. And so we want to encourage folks to fill it out every opportunity that we get.
Yes, thank you. Thank you so much.
Thank you. All right, folks, that concludes our presentations tonight. Thank you again for taking the time to join us today. Please stay warm and healthy. There's a lot going around. Please take care of yourselves and one another. And we will see you at our next meeting and the next general board meeting, which is on Tuesday, the 28th. Thank you.